Well, welcome back to NTV News First Edition, and it is time to get psyched with Dr. Janine. This week, Men's Mental Health Awareness Month is this month and this week, in fact. According to the Canadian Men's Health Foundation, nearly 2 in 3 men have never used a mental health service, despite statistics that show 75% of Canadian deaths by suicide are men. Here to discuss is Dr. Janine Hubbard. Thank you so much for joining us live again this week, Dr. Janine.
Oh, lovely to be back.
So first of all, those are some startling statistics. Do mental health challenges present differently in men than women?
They do, and that's why I think these kind of campaigns are so important. And again, these are generalizations. Of course, there are individual differences all the way through as we're talking about this. But one of the things we find is men often have their mental health symptoms present as physical symptoms. So it could be digestive issues, it could be headaches. There's a reason people show up in the emergency department thinking they've had a heart attack when actually it may be anxiety or a panic attack. So it often comes out or presents in a physical symptom. So one of the things a lot of family physicians are well aware of, it's often more irritability as opposed to kind of sadness. Sometimes it comes out in things like alcohol, substance use, workaholism, putting all your energies and trying to channel everything kind of as a form of escapism. So, I mean, obviously there's lots of commonalities in terms of presentations, but those are a couple that I always like to highlight because they're not what you would always think of if you're thinking about somebody who had depression or anxiety.
I mean, if that's the case, and it does look different, as you mentioned, than what we kind of typically think of when we think of someone being depressed or anxious, but how can we start the discussion in that case if we are concerned about a man in our lives?
What I will say is for any mental health challenge, it's always looking for changes. If you see, and again, it may be over a period of time, but if you notice that someone does seem to be much more irritable or, you know, is exhibiting any of those kind of symptoms, it's always important to kind of reach out. Expect a number of small, very brief conversations that may get shut down very quickly. But one of the things is, you know, as opposed to the how are you or hi, how's it going, it's the how are you really? Or one of my favorites is the that sounds like a fine minus. It's just the, you know, we find that changing the language a little bit can stop some of the reflexive responding. If you are able to do an activity, something where maybe you're side by side, you're not even necessarily looking at each other, but you're doing something together, that's often where some of these topics can be broached. And again, it's kind of the broach it, give some time, space. It's okay if there's some anger. But, you know, biggest myth that's out there, if you talk about mental health or if you talk about suicide, it's going to increase or worsen things. That is not the case. That's one of the biggest myths out there. So if you do have worries or concerns, use this as an excuse. Reach out and say, hey, you know, we were watching Get Psyched, we were watching NTV, and they mentioned a few of these things. I've noticed some of this in you. Can we talk? And I want to leave on the last really positive note. We are seeing increased data that's showing our young men, like our Gen Z population, being far more receptive, far more willing to engage in therapy. And so whether that's part of, you know, the social emotional curriculum that's been in the schools, whether some of that was COVID being the great equalizer where we all started talking far more about our mental health struggles, it'll be really interesting to see and kind of see, you know, where this next generation kind of shifts things moving forward.
Thank you so much, Dr. Janine. And I do want to put out there, because I didn't get a chance to put it on the screen, but if there are some people out there who are feeling suicidal, have some really dark thoughts, you can go to www.mentell.ca, and you can also call 811-988, which is the National Suicide Line. Thank you again, Dr. Janine.
Thank you.